I'm going to show you the center part of sterile dressing change, central line dressing change. And you've gotten your equipment. This is already open because I've had to use it before. You've gotten your bio patch and you have an extra mask. The extra mask you can put on your client and have them turn away. Wash hands. And then you're going to peel this away from you. You're going to set your gloves aside. You're going to grab your mask out of here. And you're going to place it on yourself. Take your bio patch. And drop it into the sterile tray. And if it doesn't drop because it's stuck, then you can just grab it. But don't really do that in real life. It's just because it got stuck to the bottom of this. Okay, discard. Now I'm taking gloves, non-sterile gloves, to remove the old dressing. How I like to do it is I like to place 2 fingers on the insertion site and I pull away at the edges. And I have my fingers placed on top of the Tegaderm. You're taking a dressing off of a mannequin, so it is very difficult sometimes. It adheres very well. So there you go. You got rid of your dressing. Perfect. Discard. You're never turning your back to your sterile field. Now, got a sterile field. Put your sterile gloves on. I'm trying to do this as fast as possible just to show you all the part that you usually get stopped up on. Now you can fix it. If you need to discard, you can discard. The only things in here you're going to need is your bio patch and your ChloraPrep. You pinch the wings, go from insertion site to bifurcation and back and forth motion without going back over the insertion site. You can also go insertion site to bifurcation and do this, where you go inward to outward circles, whatever works. And then you will discard of this. You've got your bio patch. If it doesn't drop all the way, that's fine. You just don't want your glove touching skin because your gloves are sterile, skin's not sterile. So take your bio patch, put it around the insertion site as best as possible. If it sticks straight up, it's fine because your Tegaderm will push it down the rest of the way. And then you just apply your Tegaderm. You take this off. You can come over here, write your name, date, initials, and then you place this somewhere on the client. You can discard of your gloves now or in a minute, but then the last part is the tape. And if you already have tape securing your lumens while you did the change, as you should have had, with sterile parts over, so you're just gonna apply a new piece of tape. Simple as that. So the bio patch didn't come out of the package, so I'm kind of glad that happened. So if it happens, or if this whole line gets dislodged and comes out, it's fine. That would be our fault because it's not secured well enough behind the mannequin. So just do the best you can and keep going and just don't break sterility. All done.